is you mean by what you mean by
So,
heart attack?
in simple words, if I could describe heart attack is a medical emergency. Okay, where a simple clot which clogs the arteries supplying to the heart. Okay, and that's why the patient will present with chest pain. He may have symptoms of breathlessness, and he will present to the hospital. Okay, he'll be in complete prostration. There may be increased sweating. Okay, there may be so many other symptoms. So which would bring a patient to the hospital, basically. So, chest pain in today's term has become a non-specific term.
Correct.
There may be many other causes. Even a patient may come with heart failure. But when we do a ECG, at that time we will see maybe that there has a cardiac event occurred. In patients with diabetes, in elderly patients. So they may not present with typical chest pain symptoms.
Correct,
But they may come with sudden onset breathlessness to the hospital. So in that cases also, there are many different presentations of heart attack.